What is Rasburicase? Let's start with the basics. Rasburicase is a recombinant form of the enzyme urate oxidase. It's derived from a fungus and produced using biotechnology. Its primary function is to convert uric acid into allantoin, a compound that is much more soluble in water and easier for the body to eliminate. This enzyme is particularly useful in managing tumor lysis syndrome, a potentially life-threatening complication of cancer treatment. TLS occurs when a large number of cancer cells die within a short period, releasing their contents directly into the bloodstream. One of these contents is uric acid, which can accumulate and crystallize in the kidneys, leading to acute renal failure. Rasburicase helps mitigate this risk by quickly lowering uric acid levels. It's typically administered intravenously, allowing it to act rapidly, which is crucial in preventing kidney damage and other complications associated with high uric acid levels. Now, let's delve into the mechanism of action of Rasburicase. Once administered, Rasburicase circulates in the bloodstream and targets uric acid. The enzyme catalyzes the oxidation of uric acid to allantoin, carbon dioxide, and hydrogen peroxide. Allantoin is highly soluble and is excreted by the kidneys, significantly reducing the risk of crystal formation and kidney damage. This rapid reduction in uric acid levels is critical for patients at high risk of tumor lysis syndrome, such as those with leukemia, lymphoma, or other high-burden tumors undergoing aggressive chemotherapy. Clinical use and administration. Rasburicase is used in specific clinical settings, primarily to prevent and treat hyperuricemia in pediatric and adult patients receiving chemotherapy. The typical dose of Rasburicase is calculated based on the patient's body weight and is given as an intravenous infusion. Treatment usually begins shortly before chemotherapy and continues for up to 5 to 7 days, depending on the patient's uric acid levels and risk factors. It's important to note that while Rasburicase is highly effective, it must be used with caution. Patients with glucose 6-phosphate dehydrogenase G6PD deficiency should not receive Rasburicase due to the risk of severe hemolysis. Like all medications, Rasburicase can cause side effects, though not everyone will experience them. Common side effects include fever, headache, and nausea. More serious but less common side effects can include allergic reactions, hemolysis in patients with G6PD deficiency, and methemoglobinemia, a condition where hemoglobin can't release oxygen effectively to body tissues. If you're undergoing treatment with Rasburicase or caring for someone who is, it's essential to be aware of these potential side effects and to communicate any concerns with your healthcare provider promptly. Rasburicase represents a significant advancement in the supportive care of cancer patients. By preventing and managing tumor lysis syndrome, it ensures that patients can continue their treatment with fewer complications and better outcomes. Thank you for joining us in this deep dive into Rasburicase. We hope you found this information valuable and informative. If you have any questions or topics you'd like us to cover in future videos, please leave a comment below. Don't forget to like, subscribe, and share this video with anyone who might benefit from understanding this critical aspect of cancer care. Thanks for watching.